Access Healthcare welcome you to Bladder Cancer Treatment Guide. This module is part 2 of a 7-part series on bladder cancer. Bladder cancer is one of the most common cancers, affecting approximately 68,000 adults in the United States each year. Bladder cancer occurs in men more frequently than it does in women, and usually affects older adults, though it can happen at any age. Although it's most common in the bladder, this same type of cancer can occur in other parts of the urinary tract drainage system. About 7 out of every 10 bladder cancers diagnosed start out at an early stage when bladder cancer is highly treatable. However, even early-stage bladder cancer may recur in the bladder. For this reason, people with bladder cancer typically need follow-up tests for years after treatment to look for bladder cancer that recurs or advances to a higher stage. In this course, the objective is to help you know how you will be tested for bladder cancer. Because bladder cancer causes symptoms like blood in your urine or changes in your bladder habits, it can often be found early. If your doctor thinks you might have bladder cancer, you will need to get some tests to be sure. If you have already been treated for bladder cancer, some of these tests will probably also be part of your follow-up care. Medical history and physical exam is when you look at your symptoms, medical history, and family history of bladder cancer. This will give your doctor a better idea of your risk factors. You may also need a rectal or vaginal exam, where the doctor will check inside your body for possible tumors. Urine lab tests can include tests like a urinalysis or urine cytology. Cystoscopy is a procedure where your doctor puts a cystoscope inside your urethra to look for anything unusual inside your urinary tract and bladder. A cystoscope is a thin tube with a light and camera on the tip for viewing. It may also have tools to remove tissue samples or burn away tumors. If your doctor sees a tumor or unusual area in these tests, they will remove a sample to be checked under a microscope. This is called a biopsy. Sometimes it is even possible to remove the entire tumor during a biopsy. Imaging tests let your doctor examine your urinary tract. If your doctor recommends an intravenous pyelogram, or IVP, dye is injected into your veins. While the dye is in your kidneys, ureters, and bladder, you will have x-rays taken to see if there is any cancer in these organs. Other types of x-rays like CT scans and MRIs could also be used to confirm your diagnosis and stage your cancer. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 2 of this 7-part series on bladder cancer, and come back for part 3.